So we are here today to like learn something new about like every month something new. But today's topic is caregiver versus companion. So there is similar, but there's differences. So I'm just going to go over the definition of it. Okay? So, the caregiver in assisted living are responsible for providing daily care and assistance to residents of assisted living facilities. Okay, so
say again.
caregiver. Close? Okay. I'm sorry. I'm not good with the mic. Okay. So, caregiver at the assisted living are responsible for providing daily care and assistance to residents of facilities. They may be tasked with helping these individuals with their daily activities of living. For example, bathing, dressing, eating, so as well as monitoring their health and safety. So they can, monitor recent change in health or any safety issues. And companion, primary function of a companion is to make sure their client is safe and that they have a contact with the other person. So, if you want somebody to be with you constantly, you need to have a companion. But if you want help with a certain daily activities or daily living, then you can use our staff for that task. Our staff is not going to stay with you. For example, you need help with a toileting. Sometimes you need somebody take you to bathroom and back to living room. Then somebody, when you push the button, they will be there, but they will help you with that task. Make sure you are okay, but they are going to move on to next resident. So if you need somebody constantly, that's when you hire companion. So now are you clear with the definition? Differences of companion and the caregivers? Okay.
Question?
Yes.
You said caregiver, if you want a caregiver, you should push your button. Is that an emergency or just someone to help you with some simple thing in your unit?
So this is let me just answer that question like how it all starts. Then eventually I'll get there. So when first either you choose to while you are residing in your assisted living facility, you might recognize the needs yourself, or our staff noticed something is different from the previous. So then they might suggest you might need extra assistance. Then usually our staff let me know. So I've done that multiple times. I schedule the appointment and go talk to the resident. Ask, how is it going? Sometimes I don't know resident health history at all. So I talk with the resident, find out what is the history, how it changed, what kind of extra assistance resident needs. Then I explain whole thing, the service we provided, and then after talking with the resident, right now we are transitioning, so I cannot put it in the computer yet, but I have manually do the assessment and put it in summary. So what kind of service is needed, how much points are associated with each service, and I add to the total scores, and I let them residents know for approximate cost for the month. So then at that point, residents can decide whether, put on the services or not, whether on the service or not, or certain service level, they can, change it and add or, reduce. It's, all personalized. So that's how, we decide what kind of service each resident needs. But if you are staying at the hospital or skilled nursing here, then a lot of things depending on how was your stay at the either skilled nursing or hospital. So usually I follow with your whereabouts. Once you are sent out, I know you are at the either hospital, and usually next day or so, call hospital, find out whether you are just there for the observation or you are actually admitted. And from then on, we are, me or, like a resident care coordinator will follow up. And if you come to this, our Aspen skilled nursing, then they are going to let me know. Such resident is just admitted from Eisenhower or Desert Regional. So then I know you are here. And then they keep close to the discharge back to your apartments or casita. They are letting me know this is a planned discharge date. Are you coming to assess this resident? Then usually, ideally, it should happen 48 to 72 hours. So once I schedule the visit to the resident, I will talk the same thing again, especially they stayed at the hospital or skilled nursing. Then I need to know that what kind of extra service resident needs. So then actually sometimes I make multiple visits. So then That's when I find out residents' preferences of either caregiver or companion. Then, if resident preferences companion, I can give a few like a list of the names. It's up to you to decide, interview, any agency and hire anybody. We give you the list, but we don't recommend either any agencies. It's up to your preference, and also their price point is different. So you have to call each agency and find out what is their hourly rate, how they respond. If you choose them, how many hours, per day, or how many days per week, you can get all different, pricing. So that's what you need to do, close to, like before you are coming to, you'll go back to your apartment to all casitas. But sometimes, as we all know, like once you are staying at the acute or scared, once you go back, you are not sure how long it will take for your, adjusting back to your prior level of function, right? So at that point, so usually so there's nothing is like a permanent. So you just let me know what you think you need to write at this moment, what you can do, and then once you return to your, own home, then you can adjust. Some people I see adjust fairly quickly. Some people doesn't. It takes longer. But thing is that you can always just let me know. I want to start. If you choose 5 services, for example, you can just I needed supervision for shower because I was afraid I might fall, so I wanted somebody there. But after a couple of weeks, you realize you don't need somebody there. You are quite confident, you can do by your own. Then you just, let me know. I want that service to start as of such day. Then it can be reflected on your next, monthly billing. So, do you have any questions? Okay.
Wait a minute, John. Just
Go ahead, John.
Okay. Oh, thank you. Can you tell me how much it would cost for an assistant to be in my room for 20 minutes twice a week to assist me in a shower? How much would that cost monthly?
So it's not like assessment. It's not set up like that. How it is set up is if you need somebody just a supervision, or you need a hands-on assistance, or you just and also depending on how many times per week you take shower.
Twice a week.
Twice per week.
And I just need them to be there so I don't fall.
Okay, so let me. Luckily, that number I remember, so I might just calculate that, but so that's why usually I don't give the numbers right away. I got the information, come back to my office, I put it in writing, and that's how I do it. But let me just, so you are just standby assistant with the shower,
Yes.
right?
Yes.
Okay, let me just calculate that. Twice.
Twice a week for 20 minutes.
There's no time, so it's just twice per week, that's all. That's $234 per month.
$200 per month.
234, yes.
Okay.
$200.
Thank you.
So that's but thing is that it's just, if you need to individually, I always give written summary of the cost. So, but this one number, I use it often, so I just memorize it. So, but I don't memorize every number there. So, but yeah, that's, so, for example, this is a monthly cost, but if you stop at, after 2 weeks, then it will be prorated. But you have to let me know. Ideally, if I have right now access to computer, I change the assessment right away. When you say, then it will send it to the business office and all that. But right now, it kind of still transitioning to the new system. So, but that's how it will work with these, costs. And also, one more thing I want to talk about. Yes.
I need to continue this question. I was witness to my husband getting sick and needed 3 times a week somebody to wash him and physical therapy and all this that was done at home, but because his doctor wrote that, his primary doctor wrote that, the insurance stepped in and we did not have to pay anything. Does that work here?
Okay, if it's long-term care insurance, if you have that, then covers for the care here. But not the regular health insurance doesn't cover caregiver costs.
No, it wasn't a regular, it was not long-term care. It was by the doctor's authority. He said, so-and-so needs 3 times a week physical therapy, 3 times a week anything, and 3 times a week shower. The Medicare and the supplementary cover everything. Does that cover it here too? That's my question.
Yes, there's Medicare Part B, outpatient therapy. So physical therapy covers like that. If also doctor thinks that resident need like occupational therapy, they usually come to the shower. So probably that's what that was.
Yeah.
Yes.
Let me clarify one thing on that, because I think we're getting most of the question answered.
So if a doctor writes an order for therapy services, help with bathing, whatnot, and your medical insurance is going to cover it because a doctor is writing an order for it, those services are performed by a home health company, not the Carlotta care providers that you see out and about. We are fine with you using home health companies for services. I know quite a few people do for a variety of things. The majority of home health provided services that happen inside our community are physical therapy, occupational therapy, or wound care treatment, whether it be bandage dressings, what have you. But keep in mind, that is done by a third-party provider, not by our staff. And there is a care cost to us overseeing a third-party provider provide care in this community. So there is still a care fee or care points, if you will, assessed to you, because now that third-party provider, i.e. Mission Home Health, Bridge Home Health, you're more than welcome to use any licensed home health company that you choose. We are not in an exclusive arrangement with any of them, but now they are operating inside this building under our license / my license, and it requires Helen and our wellness nurse to oversee, to ensure that they are providing the care that we, the standard, I'll be right with you, the standard of care that we have. So just because you use a home health company does not mean there's not any supplementary care points under our assessment. Did that further muddy it or help clarify?
That muddied it.
How is it figured? How is that kind of a thing?
So when you decide you want care, you're coming back, there's a couple ways you can initiate what we refer to as an assessment. Everybody that moves into the community gets an assessment. So everyone's new that's moving in is getting an assessment. If you have a major event, let's call it, a trip to the hospital, a trip to skilled nursing, that triggers an assessment. If you call us and say, hey, I'm starting to need some help with some things, I want to look into what services I would like to add, how much that costs, what have you, that can trigger an assessment. Those are the three major things that can trigger an assessment. I'm not saying that nothing else can trigger an assessment, but those are kind of the three big things that will trigger an assessment. Oakmont, just like Watermark, has an assessment document. They're different. The documents look different, but the idea behind them is basically the same. Do you need medication management? Yes or no? Now, you're not the person who gets to determine the yes or no on that. That's a question on that 602 form document that we've talked about quite a bit. Your doctor can indicate whether you're able to manage your own medications. If the doctor indicates on that 602 form that you are not able to manage your medications, that is immediately a care service that we will have to provide because the doctor is telling us, for whatever reason, you are not able to manage it independently on your own. So within the question about medication management on the assessment, it has 4 to 5 options. Do you take 1 to 5 pills, 6 to 10, 11 plus? Once we get to 11, it's 11 to infinity and beyond. Are they injectable? Because if it's an injectable medication, that is something that only Helen or the wellness nurse can do. A medication technician can only hand you the pills. You know, they do make sure it's the right pill, verify you and all that stuff, but they cannot put anything into your body, i.e. injection, IV, we don't do IVs here, but injection, they can't even dump the pill cup into your mouth because that is them putting it in your body. Suppositories cannot be done by a medication technician. So think of anything that is being put in your body has to be done by a licensed professional. So that's a medication question. With Mr. Tuitt's question about bathing, do you need standby assistance, kind of like just to make sure everything's okay? Do you need hands-on, like physical help with the washing? Do you require 1 care provider to do it? Do you need 2 care providers to do it? So all those, there's about 30 questions? 30 to 40 questions within the assessment. The assessment is a total of 15 pages. 30 to 40 questions, and within each question, there are 4 to 5 multiple choice options that would best fit your scenario, i.e. the number of medications, the type of bathing, standby, hands-on, etc. Each one of those options within the question has a point value associated with it. So for example, some questions have 2 options, i.e., do you need help with escorting or do you not? Can you get yourself to a dining room or an activity, or do you need a care provider to do it? That's a pretty black and white question. You can or you cannot. If you can, it's 0 points. If you cannot, I want to say it's something like 30 points. Because it's 32. Because that means that we now know for every single meal, for every single activity you want to go to, you need us to come get you and take you back because you cannot do it on your own. So it gets a little tricky, and it took me a while to get used to Watermark's version of it, and now I'm used to the idea of it. So I understand why it gets to be about as clear as mud on, well, what if I only wanted Monday, Wednesday, and Friday? Unfortunately, Helen doesn't have the power in the assessment tool to pick days of the week we want things to happen. That's why it's very important. And we can take the assessment tool and we have a little bit of wiggle room on some things. I don't have wiggle room on, well, I need 10 medications, but I only want to pay for 4 of them to be administered. It doesn't work that way. Well, I only want escorting service when I feel like it. Unfortunately, it doesn't work that way. So it's very important to work with health services and work with me. And Helen and I have had many conversations where I've been, can they 100% not get to a meal on their own? Like, no matter what, we can't do it. If the answer is yes, and you need assistance on every single thing, then it's 32 points. Under Oakmont's plan, it's $18 a point. Now I understand under Watermark, for those who are provided to care services, it was 60 cents a point. But keep in mind that this assessment tool, let's just say, is about 35 questions, whereas Watermark's was about 100 questions. So we have more answers inside one question. So dollar value wise, it is roughly the same, because I had the same reaction you all just had when I heard 18 versus 60 cents. I'm like, wait a minute, what? I'm gonna have to rethink all this because I'm gonna need to explain this. So I made them explain. We took the 2 assessments and I said, explain to me how they could do it for 60 cents on the 30th of April, and now we can't do it we have to charge $17.40 more. Like, explain this to me. What it is within those things, there's many more services inside of each Oakmont question versus the Watermark where everything was individually itemized out, if you will.
I just want to ask, get back to my original question.
Okay,
Let's say if the doctor
orders it.
orders all those treatments, physical, if you provide that, and then is it covered by the...
If your doctor, not your daughter, if your daughters order lots of things, I imagine you to do. If your doctor writes an order, well, physical therapy service we don't provide because Helen's a nurse. I'm an administrator and the care providers are care providers. So physical therapy is run through your insurance. You can use any physical therapy company and any whatever you want to do.
And you accept the physical therapy?
You run that with them. We do not get involved in that because they get the order from your doctor, they set up the therapy, they go by Medicare guidelines because there's a whole host of guidelines involved with progress and times per week and all that fun stuff. They do all that. If you want to elicit or have a outside home health provider. Because the doctor says, Molly needs help bathing 3 times a week and writes an order for home health. You then have to find a home health company. We are happy to work with any home health company that you want to work with. You work with them, they get the order from your physician, because they have to have an order from your physician, because for them to bill Medicare, it's the only way that Medicare is going to.
Do you provide the same service?
We provide the same service. Our service is just, if you've ever heard private pay, you are privately paying us to provide the service.
And then does the,
Your medical insurance does not reimburse you for the services that the health services provide here. The only caveat, if you will, to that, and Helen mentioned it, if you have long-term health insurance, different than medical insurance, you can get reimbursement through them. Every single long-term healthcare insurance policy I've looked at is different. So I would say if you have it, learn it before you need it, because they'll have anywhere what's called an elimination period. I've seen them as minimum of 30 days. I've seen them up to 120 days before they will start paying for whatever your agreed upon insurance rate is. I've seen some where it's $75 a day, up to like $250 a day in care. I've seen unlimited max. I've seen lifetime max of $50,000. If all of us had a policy, everybody's policy would read different. So I would say if you do have a policy, it might be a good idea to kind of dust it off and call them and ask what's the elimination period? Because the minute you need to activate the policy, activate it as soon as possible, because essentially you're paying for the service until their service kicks in. Yes, ma'am.
Helen, I wanted to go back to your original consideration was the difference between a caregiver and a companion. When coming from a skilled nursing or hospital or outside skilled nursing home, I think we also have the option of a Carlotta caregiver through your department or an outside caregiver, as opposed to a companion. In other words, if I come home from the hospital, if I wanted to have an outside agency come and take care of me, I could do that, right? And I'm wondering, some people do that as opposed to having Carlotta caregivers. Other people just go through your Carlotta department. Does that make sense?
Okay, so let me just tell, Molly will further, explain it, but when you come back from the skilled setting or hospitals, only caregivers, ours, they can provide cares, like meaning that the assistance with like ADS, like bathing, toileting. So if it's care, has to be our caregivers.
Oh, it does.
Yes.
I cannot come home from outside needing care and have somebody, an agency from the outside immediately.
Let me clarify, because within that question is a whole bunch of questions. Are you wanting somebody to come in and manage your medication?
No.
What are you wanting them to do?
Let's say you would like somebody to be with you.
So if you want somebody to be with you because you're like, I've been in skilled nursing for a couple weeks, a couple months, whatever the scenario may be, and I just am not ready. I'm ready to leave there, but I'm not ready to just kind of be on my own. That's when Helen was, that's what she's referring to, that's companion service. So you are more than welcome to have that kind of service.
Except a companion is not able to help you to and from the bathroom, or.
They can walk with you to
But
the,
if you need more,
then you get into care. And that is why you can do the home health option. So a lot of times if you're coming out of skilled nursing, and I'm glad to know that a lot of people have not visited skilled nursing, you're coming out with what's called home health orders. The social services coordinator or the case manager, whatever the skilled nursing facility is calling that person, arrange for your discharge. Does that mean you need a walker? Does it mean you need a wheelchair? Does it mean you need outpatient physical therapy? Does it mean you need help with bathing for a couple weeks? Kind of to piggyback on Ruthie's question about if a doctor orders it. If you come out with those kind of orders, they'll help you pick a home health agency. Between you and Helen and everybody, you let us know the home health agency you're working with, and that your doctor ordered those services, and you can use a home health agency for that. So that's one aspect. If you want somebody just there, for lack of a better word, as a safety net, just so somebody is with you, that is a companion. If you do not have doctor's orders, and you are needing care, that's where the Carlotta care providers come in. So it's kind of three options, but
the Carlotta caregivers come and go.
I understand.
If you want someone to come and stay for a few hours, you would need to have an outside health agency,
Companion.
right? Well, depending on how much help you need it.
Depending. Ideally, I would like for all the care to come from us, because now if you hire Helen because a friend of a friend told you that Helen's fantastic and she can be here and help you do all these things, and Helen comes in, not Helen who works here, but just Helen off the street, and provides care services to you, they are now operating under my license or the community's license. And I am saying that I think they're fantastic and they're doing everything correctly, but I don't know Helen from a hole in the ground. That's why for anybody, just roughly about 90 days ago when we were under watermark, if you ever heard Ron talk about a third-party provider agreement, that is an agreement. There were two agreements that you had to sign if you wanted Helen from off the corner to come be a caregiver. You signed an agreement that you were liable for anything they did here. So if they stole from somebody or did whatever, you're liable for it. You signed that you were responsible. If they don't give you the care you're paying for, that's your problem, not ours. They had to provide a background check. They had to provide a TB test. They had to provide liability insurance. They had to provide a COVID vaccine because of everything that we all went through. They had to provide all these things, and you now only don't become you become an employer, an HR director, and a patient to this person, and you're vouching for them. I do know that we have people who are getting those types of services, and we have all that information on those people. That is something ideally we want to phase out, because for a variety of reasons, not because I'm nosy, but because I don't want people inside this community providing services that I don't know anything about, and I don't know the quality of care that they're giving. Yes, ma'am.
Going back to...
Hold on 1 second.
Going back to home health care. If you have home health care and a wellness person or care person from here is needed to oversee that, how is that charged?
There is one of the questions on the assessment is, are services provided by an outside agency? It has a point value to it
5, and then if it's companion, I think it's 2, but it's you are getting the wound care. If you might have a pressure also or big skin tears or whatever, then you are getting, wound care from the outside agency. That's much higher. I think it's 25 or something.
So if you're getting, okay.
So the healthcare person, they're just watching, they're not doing anything, so why would it be so expensive?
Because I'm taking all the liability and the risk onto this community.
This is under a doctor's.
I understand the question, but we're assuming all the risk and all the liability, because no matter what doctor ordered it, for what reason they ordered it, they are providing care under our license inside this building. So it's between 2 and 5 points, so it's $18 to $80-ish for that. And then wound per month, it's a month. And then wound care, obviously, say you have a large skin tear, and I'm not talking like a band, I'm not talking like a minor thing. A large, you have a pressure ulcer, maybe you came back with a pressure ulcer. Also, fun fact, you can only have, so pressure ulcers or wounds are in stageable situations. So it's a stage 1, 2, 3, and 4. Legally, no matter how much I want you to be here, if you have a pressure ulcer or a wound that is staged greater than a 3, you cannot be inside this building until it is healed to 2 or below. So you'll see a lot of time. That's why wounds are a really, really big deal. And Helen and I talk about wounds every single day, multiple times a day, to make sure that nobody has a wound that is developing or getting worse. We want them to be going the other way. So that's why there has to be clinical oversight. And that's why if you have a third-party provider performing wound care, the oversight and the burden of responsibility falls on the health services director or the wellness nurse, which is why it's 20 to 30 points for the oversight of that. Yes?
But how would, normally your home health care is done by an LVN.
Okay.
How would
a wellness person know here if the wound is becoming more serious?
Because the home health company is required to check in with the health services department and provide them pre-visit and post-visit notes of what they are doing. Because essentially, while they're here, they're an employee, if you will, pseudo-employee of the community. So the home health, they may not tell you they're interfacing with Helen. Wounds, they definitely will. But they may not tell you that they're doing that part, but they are interfacing with us and keeping us up to date on what they're doing, what the progression of the wound, how things are going, is it resolved, those kinds of things.
Okay, thank you.
You're welcome.
I'm pretty loud. Helen, you're one person here. How would we receive insulin, which could be 2 or 3, 4 times a day, including at bedtime, or
We don't do that.
suppositories, or something when you are one person here and no one else is wellness?
We don't do insulin management.
Oh, you don't?
We do not.
So if you are diabetic, insulin dependent,
And you cannot do it yourself?
then you go.
Well, there are other options than that. There are all kinds of ways to manage insulin now. So you're telling me a scenario where you're on sliding scale insulin, you have to check your blood sugars 3 to 4 times a day, and you cannot manage your own insulin. We do not have a 24/7 nursing staff to provide that service. We never have. But there are lots of things now with insulin pins where it's easier to manage your insulin. It's pretty rare now where you're seeing people draw up insulin
Even a
from.
temporary treatment from, they came, let's say from the hospital, there's a temporary treatment, like a wound care treatment. Nothing drastic, but it just requires maybe twice a day wound care of some sort.
Wound care twice a day. With wound care twice a day, I would question whether you're getting discharged from skilled nursing or a hospital if you're needing wound care twice per
You're
day.
just extremely weepy, you know. And
I understand that. Then we have to operate safely for you and safely for the community. And if your wound is weepy enough that you're needing it twice daily changed, you probably aren't getting discharged from skilled nursing until it's in a more manageable situations. Assisted livings, which again, I know we have independent living, and I know we have what I'm now referring to as little assisted living, but the RCFE or assisted living license umbrellas the whole community, obviously taking skilled nursing out of the equation. So we operate under those rules. And as far as the suppository, that's why having that wellness nurse 7 days a week, we need an order from your doctor. We don't just get to go putting things in your body because you went to Walgreens and picked it up and need some help. It doesn't work that way. And we can arrange schedules to meet those needs for like limited short periods of times, but I would never sign it. I've told Mark and Mariah many a time, like sliding scale insulin. We simply can't do it. We just can't do it. There's going to be very few assisted livings in all of the land that are going to be able
Wellness could do it for a special instance, if it's, let's say it's a suppository, let's say nausea or something, so they could do it for.
Do you have a doctor's order?
I don't need one.
I understand. Does the proverbial hypothetical person we have a doctor's order, and we know it's going to be for 6 days or whatever, something like that? Those kinds of situations we would make arrangements for. If it becomes something that's regular, I've seen people get orders from the doctor for home health, and then a home health nurse comes out and does it. Those kind of one-off, very super specific things come to us and talk to us. Generally, we can figure out some sort of solution for something. But if you come to me and tell me I need insulin injected 4 times per day for the rest of forever, and that's the only option that we have, this environment and really any kind of assisted living environment, it's going to be a very hard task to manage. Yes, ma'am.
Molly, this Oakmont signature care document that we all received, it's my understanding it's being revised to be more site appropriate.
That was provided to us by Oakmont. As you can imagine, at the rate of growth and acquiring many new communities, every community has its own flavor to it. So that document is meant to be at a very 30,000 foot level. We are working on like for example, it talks about insulin management in there.
So it is being redone?
It's not going to be redone by Oakmont. What we can do is go in there and say, well, we don't do insulin management, and that Helen and I are working on to present to the Health Services Committee at the August meeting. Forgive me, I don't remember the exact day. Yes, ma'am.
I know of residents that had some kind of eye surgery and needed assistance with putting eye drops in, say, 4 times a day.
That can be done on a limited basis with the medication technicians. I know I did say they can't inject, so they can't push anything into your body via, suppository, via injection. Eye drops, applying topical cream, maybe you have some sort of a rash or something like that, they can apply topical creams and apply eye drops. I always like to caution people, when you need services 4 times a day, that does increase price on something like that. Full disclosure, something like that. But yes, they can do eye drops, ear drops, maybe you're having some, I've seen a couple of times, maybe you're having some sort of ear surgery or eye surgery and you're having to do antibiotic drops for a few days before the surgery. Those kinds of things can be added. And like Helen did mention, we give you the price based on the month. If you're only using the services for a short period of time, then you're only paying for the days that you use the service. So say you signed up for medication management for eye drops for 2 weeks. I'm pulling a number out of the clear blue sky, do not quote me on this. And Helen tells you, okay, we can do that, it's $500 a month. And you only use it for 14 days of the month, assuming that the month is 30 days. You would only pay $250, not the full $500 for that service. Did we make it worse or better? Joan, you have a question?
Yes, I just was wondering, maybe it's not like a stupid question, but
There is no such
basic
thing.
healthcare services are actually provided
So the
free
question,
of cost.
so the question is, what health care services are provided free of cost? So I guess we're going to get into a little bit of a definition of healthcare services, but services that are provided. The care staff is here 24 hours a day. If you press your pendant, they respond. If you have a minor like first aid type injury, like you hit your hand or something and you just need a Band-Aid, you can kind of clean it up and need a Band-Aid, they provide that. They also probably have Helen or the wellness nurse come the next day or within the next kind of 24 hours just to look and make sure that it truly is just a minor kind of like, oops, I bumped into something, I have a minor, what we refer to as a skin tear in this universe, outside in the regular universe, kind of a cut or a scrape. That kind of thing is provided. Emergency response services, i.e. we get there, you fell, we stay with you, we call 911, those kinds of things. That's provided free of cost, if you will, or part of living here. I like to tell everybody, if you need like, hey, I have a headache and I take high blood pressure medication and something just doesn't feel quite right, so I press my pendant and they come and take my blood pressure, we're not going to charge you for that.
They do or don't?
They do not. But if you call me every day at 2 o'clock and want your blood pressure checked, that is now a service, a regularly continuous ongoing service that is a chargeable service. So I like to try to, now this is a general guideline, it's not the letter of the law, but if you're looking for like, occasionally you need something, but not occasionally I need help with a shower. If like one time you're not feeling well and you press and they come and are just there while you're taking a shower, okay. But if every Wednesday and Friday you start calling, that's when the care staff lets Helen know, hey, Mrs. Bowie is calling us every couple of days and wants us to be in her room while she's taking a shower. Then that would alert us to like, hey, something's going on, and we go assess this situation. And a lot of times we discover it's just, oh, I just slept wrong and my back hurts and I just needed a little bit of extra assistance for like 2 showers. And we go, oh, okay, thanks for letting us know, and we move on about our life. Yes, I have to be fiscally responsible for the company, but there's no way that Helen as one person is going to know, like, we're not going to nickel and dime that kind of stuff, but if things become regular and ongoing, there are a few things we 100% cannot do. We cannot just help you with your medication one day because you don't remember what to take. That sends up all kinds of red flags about 602s and everything like that. We're going to continue to do these monthly. I know that there's probably a million unanswered questions or need clarification points. I like to remind everybody, every single person in here is very unique, and their care needs / wants are going to be very different, whether they have long-term health care insurance, whether they don't, whether they get an order for services like from a doctor or they don't. Everybody's situation is very, 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 very unique and different. And I would encourage people to reach out to Helen or reach out to myself if you have questions about your specific situation and what you need or what you may think you want to know. We can do what I call kind of like a fake assessment to give you like an idea of cost. I know everybody wants a price list. Like, I go to McDonald's and the cheeseburger is this and the fries is this. Unfortunately, it does not operate that way because Helen could do an assessment on everybody in this room And I would venture that not one person would have the same cost. And if they did have the same cost, the services provided within that cost would be different because it's unique to you and your situation. So if you do want kind of an idea of cost or an idea of an assessment for yourself, reach out to Helen and she can schedule that with you. We just hired a new wellness nurse. Her name is Rosalie Robinson. For some of you who are night owls, you may know her because she was a knock shift care provider that got her LVN, and we did not have an opening when she passed her LVN, and she started working in skilled nursing for Aspen Healthcare as an LVN. We have an opening now, so she'll be joining back our team within the next couple of weeks. So obviously when it's official, we just did the job offer yesterday, and the paperwork process started yesterday. So once we have her and know her onboarding schedule, we'll have her, introduce her to the community. I'm thinking we'll have her before the next FYI, so we'll introduce her at FYI so that everyone can meet her. She'll be working with Helen so that one of them is here 7 days a week. So if we run into a suppository issue, we have a nurse here who can do it. Yes, ma'am.
Rosalie was one of our scholarship recipients.
She was.
Yes.
She was. And she has a tremendous amount of experience in skilled nursing settings, private care home settings, assisted living settings, physician offices, as, CNA, care provider, medical assistant, and then she continued her education, and she is still continuing her education to get her RN as well. So we're really excited to welcome one of our own, if you will, back to our team. Any other questions? Well, I was going to say, I'm sure there's 7 million questions, but please, you don't have to wait till the monthly meeting. Email one of us, we can answer, sit down and set up an appointment with one of us. We're more than happy to kind of go over it again, specific need. I would also say, if you do have any questions and you don't want to come to Helen or I, you can always give the question to the Health Services Committee, and then they can bring it to us at the meeting if it's just more of a general, broad question. But please, if you have a specific, don't forget, don't hesitate to get with Helen or I. All right. Thank you all for coming. I saw Shane sneak some healthy cupcakes into the back if you need a sweet treat for the road.
Okay. How about that?
Okay, you'll hear from me later.
Huh?